Thank you for coming to our CFI Thinking Differently series this afternoon. We have a wonderful speaker, and I'll tell you a little bit about him in a minute. I just want to talk about his topic and the title, which is right there. This is not a bill. Does the patient financial experience matter? And to all of you, you know that patient experience is an incredibly important issue for healthcare leaders in the country, but even more importantly here at Mayo Clinic, which is one of our strategic goals to continue to improve and enhance the patient experience here at Mayo. But the fact that the patient financial experience is also another very intriguing thought that we haven't put a lot of time into, and we know that it is part of the patient experience in that journey when they choose to go to a healthcare organization for their healthcare needs. So today you're going to hear a little bit about the perspectives from the consumer lens on their healthcare journey to understand the gaps that our patients face when they make these financial decisions. You're also going to hear a little bit about the vision and results of other innovators who are focused on driving that digital engagement and look at some methods and metrics to evaluate the success of these digital engagement opportunities. So I want to tell you a little bit about John, our speaker. John Adractas is the Chief Growth and Marketing Officer for Simply, which is a fintech company focused on healthcare and transforming the patient financial experience. Previously, John held a general manager role in 3 other enterprise software companies, including Google, where he led the global customer success for Google Maps and Earth. John was a professional pianist early in his career, and he's a frequent speaker on innovation in marketing, engagement, and healthcare payments. John holds an MBA from the Harvard Business School and a BA in mathematics and philosophy from the University of Pennsylvania. We had a wonderful time last night with a few of us meeting with John, just hearing where we can make a difference in the patient financial experience, and we look forward to hearing from John. John, thanks.
So it's a real pleasure and an honor to be here at such an institution, and certainly on a day that, such a snowy day, to see a room that is has more than 1 or 2 people in it. In some ways, my expectations were such that I thought, wow, is this a topic that will attract and kind of be of interest? And it's one that I think is so exciting, and to be at a place that cares so much about the patient experience, and to be able to hopefully talk today about a topic that I think can really fit in and in some ways even broaden that and build upon that experience. And I think to start and kick things off, with the notion of unexpected conversations, I couldn't but help myself also as a marketer, with one of the famous words of sort of Peter Drucker, or sort of culture eating strategy for lunch. I'm in such admiration of the fact that there is a series like this, of the thinking differently, probably one of the most famous ad campaigns of all. And I just sort of put out there that I think it is such an important part of any great organization that intentionally tries to embrace, if you will, thinking differently. And in the spirit of that, here, how does one take that and run with that? So, with that in mind, what's a good way to start this off? So, why discuss, if you will, the bill and the statement? Is this a topic that one can really dig into? It's potentially one that's quite boring. Right? We're talking about a bill, and actually, in revenue cycle speak, one would call that the statement. Not even the bill. Potentially, it's a topic of joke, right? It's something people avoid because they get stressed about it. It's actually the best way to stay healthy is maybe don't even think about your bill. Maybe it's even just an intractable hole that we can't really do anything about. Why should we worry about it? What I'm going to try to do today is to see if we can flip the perspective on that. And how do we take the notion of the bill as this thing that you receive as a patient, and maybe turn it into an opportunity for a conversation, an opportunity to really flip what it is that you are, in fact, doing into an opening, a means of engaging on a really important part of your journey as a customer as you come to healthcare. Now, talk about what does that really mean. So, with that, you know what? I'm going to, 1 second. I just realized I think we're actually in a parallel, but not the correct. That's not the right way to start off today. But we are actually not in the right presentation, and I can tell that because that is not the correct third slide. So, with that in mind, voila. There we go. Look at that. Boom. Okay. With that in mind, so consider the consumer's journey, right? As you think about that customer journey in healthcare, there's a lot of things that are going on in your mind, right? And for any of you who have had a recent, experience as a patient, this is really where what I'm asking is take off the hat of all the things that you know as a member of, healthcare from an insider's perspective, and put on the hat of being someone who is just a person about to enter a healthcare experience. And you're thinking about, should I go? Should I do this? With whom am I going to do this? What's the kind of information that I can trust? Right? Is this something I can afford to do? And then, ultimately, did it go well? Would I even tell other people about this? If you think about that journey that you go through, what does it feel like? And there's this image of a person walking across a stream on rocks. The choice of that is because, in some ways, yes, we can make it across, that stream today. But how well prepared are we, right? How sort of difficult is it? And should it be that way? Right? Is it actually pretty tricky? Because if you think about the moment that you kind of put on that gown and you become a patient, there's so much optimization around making that experience work and be excellent. But when you think about the steps that come before that, when you're not really a patient, when you're not a patient yet, you may not have even chosen to be one. And in some cases, you may actually choose not to. Maybe your fear will overcome you. Maybe your concerns about whether you can even afford to become one might cause you to drop out, delay, right? Many barriers can hit you. And the thought here is that customer element of the experience is absolutely a part of the overall experience. And is there a holistic experience that we need to start to think about and to embrace and to start to proactively shepherd you through? So is this really about transactions when you think about the notion of billing and this financial experience, right? Or is there something much more? As we start to think about this journey, and that begins, for some people, with picking a doctor. If it's an emergent situation, you may not be picking anything because it's literally just happening as you speak. And moving on through that process where you're thinking about that financial responsibility, moving on through scheduling, and on through point of service, and on through ultimately to having a bill. This notion of that financial journey, this is this broader framing, if you will, where we take what was once the bill or the statement, and now we say, there's this parallel journey that goes to the clinical one. And how do we start to take that and say, how is this impacting our ability to make the success of a patient? At this point, everyone potentially has something to eat or has food maybe on the brain at this moment. So I'm going to put maybe some food that looks a little different in front of you. But what I want to is let's step out of healthcare context. And let's think about the difference between delivery and an experience. So I don't know how many of you love to cook. Maybe a quick show of hands. Does anyone in the room enjoy cooking? All right, so maybe a third of you. So I love to cook. I'm getting ready for Orthodox Easter. We get a little bit more time than for those of you who might celebrate the upcoming Easter, the other one, as I like to say. But when you're in the kitchen and you're in the back, there's a series of back office things that effectively are happening, right? A lot has to come together to produce a great meal. But then when you're on the receiving end, right, think about what it is that's on your mind. Is this going to taste good? Is it being served to me at the right temperature? And all these things that come together, and you get that delicious, and this is a picture of a lamb. My lamb actually, that's not exactly my lamb. Mine's pretty good, in fact. And you deliver that. And when you do, not everyone's thinking about everything that went behind the scenes. And by the way, this is meant to be a commercial kitchen. Because now I want to transport you to a business doing this. And a lot happens behind to deliver what ultimately is your eating pleasure, your experience. But now think about a step beyond that. In order to deliver that, you're responsible for even much more than that, right? Because what can get in the way of having a great experience? If you couldn't make a reservation easily and the hostess was, kind of disorganized, if perhaps, the waiter, bad breath, it brings out your food really slowly afterwards, if, you couldn't make payment because they didn't have their card reader, they decided they only wanted to take cash, or something of the sort, you wanted to pay by check, whatever be the case. You couldn't even park, because that restaurant's in a place where parking's impossible, right? All of this plays into your ability to have that experience as a customer. And any restaurant owner would know that that's their problem. And if you as the customer, do you care? You don't. It's a very high bar when you start to think of the broader notion of the product that you deliver. Because there's the core product, and you could say, hey, I'm a French chef. I'm a great chef. It's about my food. I'm delivering you great food. I don't care about parking, payments, hostesses, and the mostess and the waiter. But you know what? You have to. You fundamentally have to. Because the rest of that is part of your experience to be able to have that in the first place. And I will get off of this analogy, but I hope that what it transmits is the notion that enabling that success as a customer, that in other industries, the notion of customer success has really risen and taken great momentum in recent years. And that the notion of patient success, I would put that up there as a notion that, how do we create the notion of patient success? Start to think about the job to be done of a patient, and how do we ensure that's being achieved? And that the customer has a lot that they have to get through to even become a patient in the first place and to succeed. There's research building, right? It's the early days in thinking about this. So I can't stand before you today and say, oh, let me show you the vast history of the decades worth of research here and the meta-analysis, right? This is an innovation area, right? So it's emerging as we come. So I'm going to show you tidbits of things. This is a good example, right? The experience that one has in the billing and the payment is already showing signs of being linked to not only payment itself, which that's pretty intuitive, right? If you have a bad billing and payment experience, it impacts whether you pay in full. Makes a ton of sense, right? Because look at the contrast and difference here, right? Is that, 74% versus 33. That's a 2x difference. Beyond that, whether you would recommend the hospital to a friend, 15 versus 80%. Look at that stark contrast, right? That's pretty dramatic. So we're talking about impacting loyalty and impacting that. Might not be causative, right? We don't have enough data to suggest that. Correlation, yes. And this is a study that's longitudinal over 5 years. Smaller data set. I would tell you now that my research, which expands over tens of thousands of patients now over the last 2 years, suggests the same. Spread over geography, rural, urban, and this trend is one that will probably continue to accelerate as people are learning to differentiate and to do this even better. This was when there wasn't much differentiation in financial experience, just beginning to tap into this. And what is it we're talking about here, right? We're talking about a train that's leaving the station. Outside of it's really a macro trend. The fact that insured patients are a rising but challenged payer, right? Because they're not a payer that we're accustomed to. Look at the language that we use, right? We literally call insurance companies payers, and we explicitly don't call the patient a payer, right? We use the language of commercial entities, and we keep the patient kind of cornered off, and we have an apparatus of commercialness, and we don't have an apparatus, one might say, of being retail in nature. And retail has its baggage too. The moment you use that, then you start to say, well, this isn't a retail product and it's very different. But maybe we're in the early days, though, of the emergence of at least a customer-like behavior. And you look and you say, well, wow, 5x growth in high deductible plans in just 8 years. That's pretty rapid. And you can kind of understand why adoption hasn't caught up yet. And you look and you say, it's already resulting in a pretty bad increase in bad debt. That's largely hidden in the larger numbers of the financials of a hospital. But this is creating impact changes. Already, just saw a study only last week of revenue cycle leaders that now cite 75% of them citing high deductible plans as the biggest threat to revenue cycle. Fascinating, right? This is becoming the issue du jour. Sorry for the pun, for those of you eating any food of the day. So we're talking about expectations that are coming from our everyday lives as customers because we're now being treated like a customer, if you think about it, right? We're being asked to pay amounts that look like what we do in our everyday lives. It's not $20. It's $100. It's hundreds. No, it's 1,000. There are plenty of studies that you could go and I could easily throw at you that say an average person who's asked to suddenly pay $1,000 unexpectedly cannot afford it. And you think about what a healthcare bill looks like. Right? A healthcare bill is actually really exciting to the payments world, right? Because they're accustomed to e-commerce. And e-commerce, the average order value is like $50 or $100. And in healthcare, the average bill is in the low hundreds. And you often have bills that you're asking someone to pay thousands now, right? Think about what the Affordable Care Act has introduced in terms of plans. And do people really understand that? You know, I don't want to get into any politics, but think about the implications. We ask people to pay bills of a very large amount. And intriguingly, here's a nice data point that kind of ties it together, is the amount that we see in terms of people putting on a payment plan, because we've enabled people to pay a payment plan on their own, is they actually put the same amount that an average bill is being paid in healthcare. That kind of makes the whole world make sense, right? Is that people basically, they have a certain amount that they're able to pay. And then when you ask them to pay amount way above, they basically try to get back to the amount that people are able to pay. But when you don't have the capability to offer them that, they kind of go, whoa. They just stop or they don't. They don't pass go. Right, so the kind of things that you think about in this new world is people, when you shock them with things that stick out dramatically from what you're accustomed to as a customer, bad things happen. Think of it as behavioral marketing, behavioral in general as a practice, right? Behavioral finance is a really powerful, trend in terms of thinking, right? Modern designs, things that create barriers. This is how we influence people. And if you think about what you're trying to tap into, cool beeping going on, probably thinking of mobile, right? It's a good another example, right? Is that we have become mobile, right? Unbelievably mobile. Who amongst you, just raise your hand right now, it's like, who in this room has a smartphone? Huh, right, fascinating. Who in this room, when you go to the airport, checks in on, by themselves and doesn't plan to stand in line? Oh, wow, right? So fascinating, right? This has become our norms. This is what we plan to do. But think about in the healthcare context, how many things that you still do where that's not what you do, right? Yet you go to the bank, you do all these other things, you're able to do that. Payment plans, readily available. I can pay my energy bill, my insurance bill, for home, for auto, all these things, and I can easily put them on a payment plan, like all of these things. The experiences have been sort of thought through, but in healthcare, it's a bit challenged. And I always love this stat, actually. Found this, but in some ways I'm going to beat up on it right away. 71% of people prefer, they think of valuing their time as critical. How many people love, having their time wasted? No one ever answers that as a positive, right? Because it's kind of like, what a joke. So what I sort of offer to you as an example to think about from outside of healthcare is to think about the airlines. Not known for high margins, not known for necessarily being a very simple industry, right? Tons of complexity, right? They don't control the airports. They don't, they live in a world of in many ways a highly regulated, environment as well. There's some similarities. You could argue, right? Every industry is different. I'm not saying healthcare and airlines are identical, but think about. They managed to go on a journey, making a strategic imperative that they would interact differently with us, all of us, as a customer. And that within 8-year span, they were able to turn what begun as an experiment into the norm in terms of moving away from paper, which became a way that we learned about another way, and that people became the exception handling process, where it became how you get a higher value service for when you needed it. And that in general, we became empowered to do things on our own, and that works for us. And that we saw by a sample of this room, it's what is the norm. And in fact, if they asked us to stand in line now, we would resent it. The same in financial services, and we could go on and on down the list of where this has occurred. And it wasn't great in the beginning. And you may, for those of you who may remember where you were the first time you ever tried to check in. I was at Newark, and it was Continental Airlines, and it was pretty crappy. And it took them a number of years to keep iterating, making it more convenient, making it more trustworthy, where you'd actually say, this is something I would choose to do. And now they're trying to make us bag tag. I swear eventually we'll be carrying our bags onto the plane personally and putting them up into the big spots. Who knows? So is there a paradigm shift? Think about it. The patient financial experience is literally something that you interact with every single patient. You spend the money and time to do it. It's the first and the last impression when you think about the entirety of it. And it's significant money, certainly to the people you're asking. And beyond that, increasingly, as an organization, when you don't happen to collect it. So from that perspective, is this a complement of two journeys? The clinical one, the core product, being complemented by this journey that together creates a healthcare's customer journey, and that you need these two pieces in order to ultimately give people what they need to be able to consume this product. Increasingly so. Otherwise, you lose too many, or you will continue to lose as more and more people are affected by the financial aspects of the journey. So with that setting of perspective, let me move and describe a bit of what this new model looks like, and give you some shining examples of companies that have definitely thought very differently, and literally entirely new entities that have emerged, and today we may not think of in this way, but they have shown the way of how the world can be dramatically different, and have created great value and have changed the world dramatically. This is not going to be easy. I'm not speaking of anything that is about a incrementalist change. This is not evolutionary, this is revolutionary. It's about strategic imperative to decide that groups that don't necessarily work together need to. It's about talking about revenue cycle, who thinks about, billing, cycling revenues, look at the names. And marketing thinks about acquiring patients and about engagement and patient experience and what is focus. And being able to think about these worlds, focusing in on this problem and adopting it as critical. And thinking about this as part of what's critical for future success in terms of building an advantage around this. And the notion that today we live in a world of things known as Dunning cycles, right? That's the classic name for what it is we do. We send out a statement, we send out a statement, we send out a statement. And then we try to minimize the cost of that. And when it fails, and it fails 90% of the time uninsured, it fails 50% plus of the time and insured. And we call that success or good enough. And think of the staff-driven and the third-party collections aspect and the transactional, and we call it it's a pain point. That's our euphemism for it, pain point. Moving to the notion that, is it a pain point or is it an unbelievably undertapped engagement opportunity to think really differently and to apply the marketing thinking inside of this context? And to think about what happens if we actually optimize it around getting people to be empowered and do it on their own. Because that meant that that we had their attention, that they must have trusted us, and that they were able to get it done because we gave them whatever was missing to help them get more of them done. And that, wow, that's fundamentally different. And that we started to get the feedback loop going so that we could make this process keep improving itself. So that we were set up to do that kind of lean innovation that we need. The kind of stuff that the CFI is thinking about and has on its wall. Fundamental to making this kind of thing work. Because what we're talking about is people being motivated, capable, and trusting. And how do we build and do the kind of things around exactly that? And we could dive into details of this, but in some ways, I think I'll try to do it by showing you kind of some of the things that we're talking about here. And this will be something I can share with you afterwards. The notion that behind the scenes, as I mentioned in the kitchen, there are things that can go wrong, but the patient, or I should say the customer, doesn't care, right? If the lamb and the other things you serve come out at slightly different times, and then you serve it and the food is partly cold on the plate, you're bothered, right? If you couldn't park or whatever in front that day because there's issues and you don't happen to go out and get a valet to service your restaurant, that's your problem. If you're really thinking about, well, how do I enable the success of my customer? It's your problem. You need to think about it. When I went for my surgery, everything was relevant in terms of how was I going to get there that day, how was I going to figure out the amount of money that I should put on the FSA, all of these things. How would I choose the surgeon? How would I choose the option? All of these things were relevant. And they were all interconnected decisions. They're not isolated events where only the doctor thinks about the one and the other. All interconnected. These are great examples when you think particularly of the financial journey. How do we shield people from this? Right? The notion that this is not actually this is not really okay. And I give example, and I hope it doesn't touch too close to home. One of these is yours. You might recognize it. Right? One of them isn't. And it's not meant to be about who is it exactly. The idea that we go and you click pay a bill, and suddenly you see like this thing that smacks you in the face, and it's like, oh, I have to figure out, well, where did I go? And oh, wow, there's like 3 different things to choose. Oh, wait a minute, am I logging? Am I signing? Am I making a? Well, that's a lot. That's a lot going on. Right? And if I'm the patient, it's just like, I know I went to somewhere, and I got to go and figure that out. And it's very confusing. And in some cases, you get really kind of, the notion of, oh, I was discharged before this date or that date, and it can relate to where your bank account was from or where's the money flow. And it can get even worse as you can get in sometimes, where it'll be, depending on the payment plan, that can be set up differently, and it can be really confusing. And then going beyond, you've given them the capability, but you haven't really supported their decision, right? Where we do things, oops, wrong button. I should think about this. There's a lot of great work, in terms of behavioral psychology, about the notions of escalating commitment and the notion of how you get people, the kind of thinking behind design. That where I'd say healthcare, being able to adopt this is really important. Because Disneyland's a great example, right? They get you to stand in lines and to think about it. You don't even realize you're doing it, right? That's what's fascinating about a lot of this work. Where as you start to think about landing on a page like this, what's your first impression in your gut? It's sort of like, ugh, I got a lot of work to do. So you're not that committed, as opposed to the notion of the kind of gradual. And there's something like this, which this is very common actually, where it's like, I'm going to fill out an amount. And sorry, this is not very high res, I see now. Filling out an amount, and then an account number, and then that gets lost actually. And then next thing you know, the people you paid a payment to lost your payment, and they can't even find your payment. It's more common than you think. And what's sort of stunning, it's like, and I could go to your schedule page, and your schedule page is actually about 16, looks pretty similar to this. And people grunt when they see that. because it's that sense of, wow, that's a lot of work to do. I don't know if I'm going to do that today. It's just yet another barrier. And we've kind of grown accustomed in modern design thinking to get away from that and give people the impression to make things easier. So in general, this higher bar that I would suggest that we think about from this paradigm of the customer experience is move to the left, if you will, right? Think of this engaging early and regularly first. Second is moving up this stack. And by the stack, what I mean is where the patient sits at the top. And this is, I've seen so core to within Mayo. I love when I saw, the fact that you guys have the patient at the center of things. I so love it. I went last year to HFMA and you go to an event where they had 3 circles, and the circles was like the hospital and the physicians and the payers. And I was waiting for the patient circle, except there wasn't one. And I love the fact that you have that. That it makes me smile like you wouldn't believe, and that's so core to who you are. And I say this so aligns, I think, the notion that the patient being empowered and doing it on their own and making that a KPI, because the biggest success and compliment ever in this world is when somebody has done something on their own because it meant that those conditions were met. It meant that you had their attention and motivation. It meant that they trusted you. And it meant, thirdly, that they were actually empowered to succeed. And that's really important, because view it as actually a failure when a patient couldn't do it on their own. Now, maybe for clinical, I don't know if you can apply that, although maybe you could even challenge to see there, I'm out of my element. But certainly when it comes to the kind of things like a financial journey, you can apply this standard. And then failing that, now that they've been assisted, first and foremost by your staff. Because your staff knows your mission, your staff is the best people prepared to handle those exceptions. And then beyond that, maybe a third party. And the kind of people that you have vetted and you know that you want to interact with. And then failing that, of course, the outcome that nothing happens. And you figure out that path. But that have a very conscious stack that you want to work through. Well, put the patient doing it on their own at the top. And then, thirdly, that you have a feedback loop that's closing blind spots. And by blind spots, I mean the notion that the HCAPs, that what you do that comes 3 weeks later, that is a very technical implementation, decided by CMS, that you absolutely have as a first round of figuring out your survey, or of what people think. But that has also massive gaps. It has a response bias. Right, in terms of who's going to respond to that. And you have a notion of the timeliness and your ability to get feedback. It's not a real-time mechanism. And what you're going to learn from that. And it generally doesn't cover much of this financial journey. If at best it has maybe one question. So how do you start to think about the feedback loop by broadening the scope of what's talked about, broadening the response of what you'll get, because more people respond when you ask in real time. That will change things. So then just to now put it in the context from the field, thinking about how we can take things like a classic bill and the classic sort of online bill pay, and to be able to say, we can do things like making it easier, whether one is going in through a portal, whether one is going in through a guest, and the fact that people really appreciate making it simple and convenient. And this is just an example of in terms of, but the fact that you are complementing what you may have internally in terms of a portal, but also expanding so that you want to make it as easy for whatever is the path that someone wants to be able to come through. That you are setting it up so that someone is effectively being introduced potentially from the paper side, but to the notion that there's actually more information available in a digital format. Because you're making digital, if you will, the place that you want people to go to. Because good things can happen when you get to a digital engagement paradigm. Right now, this is, to be clear, I do work at a company, and this is, I'm showing you examples from the field of what we do. But this is not just about the work that I do. I think broadly, this is definitely about what one can do and sort of success that one is seeing. What we have found is, again, this is an example where as you drive people to become aware that the paper bill may have a certain level of information, but you can't send everyone a detailed bill. And you wouldn't be able to economically. But you can actually enable people to have access so that everyone by default could actually have a detailed bill with whatever detail makes sense to give. And there'll be details, we had a discussion last night, that you might not want to include. But that you can actually create a detailed interactive bill online. And you can help people to work through their gross charges, their insurance amount, their portion specifically. You could ensure the financial assistance policy and other things are there available to them. And that this is the means of helping those who want extra information. And you can start to learn now, because it's an engagement environment, who are the people who take advantage of this? Understand what part of the population needs that and help them to get that. You start to think differently because it's not just a paper statement. You can think about emails. You can think about mobile, SMS. You can think about other ways of interacting with patients. And it becomes a dialogue that adapts what you say at different points. So you can welcome people. You can let them know they have a bill. You can come back with reminding them. You can go through the flow and adapt how you say at what point in time. And this is part of what I say is in terms of this is what we're accustomed to in other walks of life. But how do we bring healthcare kind of to this notion and to be able to have the communication kind of adapt to us? And to think about, you know, as you get to paying, maybe they're prepared to pay the full amount. Maybe they're going to pay another amount or paying over time. And as we talked about, we see that the data shows that people are trying to pay over time, effectively hitting the amount that they otherwise would have been paying for those that pay full-time, pay the full amount. And what's fascinating is the feedback that you get from talking about payment plans is miraculous. It is, in some cases, almost, will make you get a little teary because you'll see people put in stories. They'll actually share in the feedback things like, I lost my job. I was really very concerned when I got this bill. Thank you, thank you, thank you, exclamation, exclamation, for making this possible. And the fact that we also start to move to a paradigm where a lot of people don't want to have to call. It's very putting themselves out there. You're enabling a shame factor to go down. And this focus, it enabled satisfaction to become really high with this experience, which as a whole, when you start to measure specifically billing and payment, the average is in the 30s to 40s. So 80%, to put in context, is really high. Beyond that, as you'll see, we look at Net Promoter, which is a marketing technical scale for those who may not be familiar. We find actually we've been able to drive that into the 40s, which is more like retailers, like and you might see the Amazons and the Nordstroms of the world, where in healthcare an average is in the teens. So it's very, very different. Kaiser, as an example, puts out a press release talking about that they hit 41. We're actually in the average now across all those that we work with in the 40s. So our average for everyone is now at Kaiser's, if not above. And the self-service amount ends up jumping dramatically, where it's usually something it hits instantly and it just goes up. Because you're basically just giving something that everyone has wanted all along. Because it was just that you made it very difficult. And it's not just that. What happens is, more important than that even, is that people they're able to pay more. Beyond paying more, look at the kind of things people say, right? Literally, right? It was so great, I didn't have to call in. I almost fell off my chair, right? You don't have to be a rocket science to go through the process. When I say that this is an experience that needed to be addressed, you see this kind of stuff over and over again. And I would tell you, at this point, tens of thousands of patients that go, the feedback's pretty consistent. And we're not stopping there, right? Now what comes live this week, it's already been in soft launch, is let's empower patients at pre-service. Let's enable a patient to go in, choose their care bundle, put in their insurance card information, and actually see an estimate. And then proceed with thinking about with actually scheduling, and then move to the notion of payment right then and there, and combining that. Think about how all these pieces come together. That's where this is going now. And Lancaster, as a part of the UPenn system, super excited about this, right? And that's just one one system. There are others who are already doing this, and this is actually becoming a very popular notion. And what I would say is there's a little bit of a theme that whether it's the provider doing it, whether it's an exchange in your area who's already doing it in some sense to you, or patients asking for it. One of the first providers we ever worked with, I always used to chuckle. The most popular page in their website was patients trying to look for a cost. And they had this kind of crazy page that showed like big ranges of how much things would cost, which they were never very proud of. But it was the most popular page. Generally speaking, if you go to most providers, and I've done this and I'll ask them, and they're always a little embarrassed, is if you go and you ask your Google Analytics, whoever runs Google Analytics, you'll find that it's probably one of the most commonly requested Google searches on your website and/or pages. People want to know. And asking and waiting for an answer later is not that satisfying. People also want to know like now, when it is. And the more competition you face, the more acute this often is. Beyond that, Memorial Hermann as an example, just to give you another context, large system, able to move pretty swiftly within 5 months, live everywhere, 1,200 staff, large patient base in the Houston area, able to drive self-service, achieve the satisfaction, very high. It's actually now in the mid-40s in terms of their net promoter. That was initially. Drove cost per payment down by almost 25% and drove collections up higher. So this ended up being really a triple win overall. And beyond that, the marketing team is extremely excited because what has happened is revenue cycle is now a driver in marketing where they now get opt-ins from the revenue cycle flow and is now the #2 driver of opt-ins in the marketing, because these two things now work in tandem with one another. Gunderson, nearby, a neighbor for you, they, similarly so in terms of satisfied, cost per payment lowering, incoming calls, because they were able to take off really people calling to just process a payment or update their basic information, all things again that you could do on your own. They were able to literally move 24 FTEs to higher value services for a patient. Really important when you start to think about the impact, doing better for the patient while enabling patients to be empowered. So in closing, we're talking about a common denominator that we can repurpose to be much more valuable when you think about the fact that it's not addressed, at least in a very forward, strategic way. How do we engage patients and start to think about a compounding advantage, particularly when you say that the fee-for-service model maybe is just the practice grounds, right? As you move to a accountable care organization model and where it becomes about outcomes, does engaging the patient actually become a critical part of the business and a necessary ingredient for success in order to kind of have that capability where it becomes a competitive advantage that you have learned how to engage with patients in this manner so that you're able to kind of basically grab attention, build trust, and ultimately enable people to succeed. These two things are sort of on parallel tracks. And ultimately, that hidden in the status quo in the history of business is certainly new possibilities that can be yet to emerge. And this is perhaps a really important one. So I hope with that we've started to uncover some interesting things, and maybe we can get to some questions.
So I'd like to open this up for questions. So John, we'll take a seat right
Sure.
there. And first of all, I want to thank John. I think he did a fabulous job of taking a very complicated billing experience, which all of us think of every day, and gave some great examples that it can be simplified and it can be a better experience for our patients if we can take advantage of innovation and digital experience. So much was shared. I'd like to open it up. Can anybody have any questions right now? And yes, Matthew. We've got a mic. Matthew, we'll bring it over there, and then everyone can hear it.
My question is, how do you deal with transparency and the various pricing that would come with a number of different contracted payers?
So as far as transparency, this is it's an area where it's newer. So this is definitely one where I can't say this is what's been happening for years. I think it's one where in the land of the bitter pill, being on the minds of many, and thinking about that in the comparison with now you have exchanges starting to put the idea that one can compare before you go out, and potentially competitiveness in terms of maybe a provider is starting to also show prices. I think you have a sort of a tough environment. I think figuring out what's the right level of transparency is a topic that will be figured out as we go and as this evolves. The notion that people want to know something to be able to do basic planning and budgeting, I think that perhaps is the underlying spirit of this. Whether or not you show an unbelievable level of line item detail that's incomprehensible to some people, that will probably be figured out as we go. We were talking about this last night at dinner, and that there might be too much detail, but some level of transparency in advance, so that a person who is about to pay $1,000 or $2,000 and they might not have, and one, see the transparency, and two, pair that with a financial aid package so that they can then get comfortable, because it's really about, okay, I can understand that, and two, I now see my path forward to how I can address it. I think that's the theme. And figuring out exactly how that'll work, I think that's what's to be tackled, but not tackling it, I don't know that that's a choice.
I guess more specifically, if you look at like a Medicare patient versus a commercial pay patient or a self-pay patient, you're going to have, I'm not really familiar with what the difference would be, but you're looking at, 8% of the price that a commercial payer or maybe without a strong contract or self-pay patient would have. How do you deal more specifically with that kind of price difference?
I mean, I think this might be in some ways, whether or not this is something we could talk sort of more offline. The fact that each person will have, differences, I don't think we're moving to a world where when you go on and you try out an estimate, you're not able to estimate for someone else's insurance. So I don't think we're quite moving to that paradigm where you're posting your prices across the board. I think that's does that phase occur at some point? Perhaps. Whether or not that's what we're talking about today, I think we should put that aside. Today, the fact that you can go in and I can take my insurance with a Cigna and I can understand how much I would have. Whether that
so you are taking into account the patient's insurance and you're showing them prices that reflect what their current payment system. Okay.
That's the movement, is that I can understand, because it's not very useful to know theoretically what someone would have. Because my deductible, could be at a certain point in the year. I want to know what's it going to be if I went and do the surgery now, right? I want to know what's it going to be if I'm going to enter and have. So I need that eligibility check and to understand, what is the actual bottom line for me. And that's the movement.
So I want to follow up, Matthew, on that, because I think that's a good point to take on. Now we've opened the door, we've given some transparency. Yeah. Do you have data or from your experiences with other organizations that is more likely in the pre-service digital experience to result in an appointment when they have that information in their mobile device and they can track that? Do we know they're making more appointments, or are they tending to go now doctor shop and compare because they're looking
and so right now that's in the emerging camp for, I'd say, not enough history to be able to say one way or the other. I think it's definitively coming from a place of wanting to be let's try to build a competitive advantage and to try to combat, if you will, pressures and to see if we can actually achieve that, as opposed to wait and find out that we need to do this. So I think there's a choice of where you want to be in the innovator's position. And do you want to be the responder, or do you want to be the one, trying? And inherent in that is the risk of what will this achieve.
Great. Take any other questions? Anybody? Oh, good. Here we go. Cindy? Amy, she's right in front of you. Get one of you. Go ahead. You got the mic.
Okay, so I guess my question is, it seems like a lot of the examples that I think of in my own life as self-service examples come as a result of failure of their customer service, right? So a couple examples, like I call into a phone line and I hear the same exact question twice in a row. Push one, hear the same question twice, right? At the grocery store, I would rather not check out my own groceries, but I'm doing it because the lines have gotten so long, right? And so I'm wondering how you think about kind of optimizing your existing customer service processes as you go forward with self-service efforts.
So I'm super glad that we talk about this. So it doesn't and shouldn't imply in any way that making self-service as a strategic, focus, that it's a license to do it badly. And I think there's tons of examples, and the grocery line is a great one where figuring out what's its focus. And it's also the risk of talking about the airlines, because I think most of us, if you picture the airlines, you also would grunt that you don't feel well treated. I think some of that's also part of the dynamic of, is it more of a monopolist, feel, or a duopolist in terms of that. And one would say in healthcare that in any given locality, many providers are more like a monopolist. And without to go too far with that, I think there are differences in how innovative pressures are felt based on the individual geographies. At least I would say, and I'm observing now, having not been long in healthcare, but having been long in technology and and having been on the venture side as well, is that where I see the first movers tend to be in the areas where they feel the market pressure to act, and that there is often a desire to innovate, but at the same time, the areas where they will take the greatest risks tend to be the ones where they have the perceived competitive pressure to do so. But I think, to get back specifically to the question, I think keeping the patient experience paramount and ensuring that if you think of self-service as, in some ways, a great test that customers are succeeding, if you're pairing it with surveying and you have your other checks, which should still remain in place, that you're doing right by the patient, and that you're not just allowing this to then you cram them over here as a cost-saving initiative. It depends on why you do it. And I think that says a lot. And when the airlines are doing some of it, it was on their own survival because they literally are so low margin that they needed to. Or when you're talking about another low margin business when you say the grocery store.
Yeah, that's a good point. Cindy, you had a question?
I think we have a really powerful patient portal, and the idea of patients being able to access their billing information and pay online is exciting. I would be curious to know about the healthcare organizations that you've implemented this model and put it on existing patient portals. How big were those healthcare agencies? How many patients were they seeing, and how, just getting a sense for our patient population compared to other companies that you've implemented.
So we work with, ranging from Cardinal Health and LifePoint, Gunderson, Memorial Hermann. So we work with a range, so from regional health players to national health players down to community hospital systems. So I think that's a good offline topic that we can happily spend time on. I think the notion of it being a complement, where from the portal it absolutely is a ability to be an extension of the more clinical-oriented activities that one can do, but then taking, when it comes to the financial journey, but really doing that very well. But then also enabling you now to have those that maybe aren't there to have a portal-oriented experience, or maybe aren't utilizing the portal, and suddenly create an alternative path where it really works well for them, and that these two things can work in tandem. And when you start to think about that, the first piece, which is catching their attention and making it easy, that is the core essence of the message today, which is you have to do that. You've got to give in the notion that you need to address this, and not by piecemeal. They'll have to work together. If you've got a point solution for this and a point solution for that and a point solution for this, you can kind of sense it as the customer. And you got to figure out how they all work together. It'd be kind of like the hostess isn't really connected to the waiter, who's not connected to like the valet. And when all these things are well thought through, it works really well. But you need them to not only be thought through, but to still remain lean innovators, because this is not a mature area. This is an area that's literally adapting, you know, as we speak, and still changing. So it needs to both be harmonized as well as still adaptively innovative. And that's actually pretty complex when you think of it that way.
That's a great point. We've got time for a couple more. You right there? Yeah, go ahead.
You kind of led into this a little bit, but I want to step back to the patient experience. What are the best strategies that you found in engaging the patient, extending the invitation to experience this differently, and letting them know that this is easy and simple and you'll be glad you tried it? Because that first step of trying it is always the hardest.
Oh, absolutely. I think some of it starts fundamentally with there's language and choice of language. There's visuals, and I think, you know, a lot of it's being able to sort of step outside of the paradigm of you know, kind of the status quo, which in some cases I found when I first started doing this that you know, I would encourage this as even just as a methodology. That you know, I asked my wife and says, you know, please don't get upset, but I'm going to put all of our household bills up to the point of collections. And I says, I need to do this. I just want to understand, how does it look? And it's fantastic when you start to see, like, how does American Express take some brands that we're familiar with, that we might respect, and, you know, Comcast, you know, take every bill you can think of and see what the difference is. And I've been doing that. And I'm also a nerd, so I've been collecting like every bill since the beginning of time. And then you take your healthcare bills, and you look and you see why they look different. And then when I went back and I started asking, like, you know, initial customers why they did it, the questions that were thrown at me then were things like, oh, we have to do that. That's like regulated. And then I would look and say, well, is it really? Like, is it just tradition, or must you? Because there's a lot of signaling, is what I would say, that goes on. And that signaling triggers behaviors. It's kind of like if you walk down a street and all the houses look a certain way, and it kind of makes you feel like this is a good street, right? It's like a family street, it feels good. And then there's this one house that looks really out of place. You don't go there with your kids for Halloween because you think that house is like dangerous.
Your conference is scheduled to end in 2 minutes.
Bill in the financial journey. It's signaling. It's signaling hassle. It's signaling don't pay me, because you're probably going to see me again and I'll be different. It's signaling to you that, by the way, if you need help, it'll probably be a little harder to get than for other experiences. It's signaling a lot of things. So if you look at like the behavioral psychology, like how you influence, and you look and you see the things they recommend, and then you look at healthcare and you stack it, you'll see like, wow, you're actually not doing most of the things they would suggest. And you say, wow. So what I would encourage you to say underneath is independent of like what we do, is that's the kind of stuff we've been thinking about now for years and building in. And then once you start achieving and making some success, you then get data, and then that feedback, that helps you to do more things. And then you start reading what works for you, what works in your geography. And that's a compounding advantage that I would say you need to get into. And then the more you get into it, you'll start seeing people, you'll get proud, because you'll say, wow, they're now talking about how our competition doesn't do this. And then you go, wow, that's useful. But you need to have access to it. Because once people start talking, you'll realize, wow, that's really great. And then you can learn how to build more things and take the next step. But you cannot, a journey of 1,000 miles starts with the first step.
But I like what you were trying to get at. Where did you get that patient, the voice of the patient from, when you were getting these experiences from? How did you capture that through the billing world? You would interview patients, you would observe them?
Talking with staff, observing, and this is the kind of thing, I mean, also just going out and talking to people. I had my driver yesterday to understand the first Mayo patient that I spoke to was my driver yesterday. And I asked him, and he opened up and started telling me about, I asked him,
Your conference is now over. Goodbye.
To talk about why he chose Mayo and why does he go here. And, you know, user groups are great. Getting